Hi everyone, my name is Michelle Wu and I am a nurse. I'm 33 years old and I'm from Sacramento, California. I am currently an RN BSN. I recently graduated in December of 2017 and I currently work as a wellness nurse with a company that contracts with several companies in the Sacramento area where I get to go and do a lot of health education and health screenings to make sure that the employees of the companies are learning ways in which that they can make healthier choices. Besides being a wellness nurse, I'm also going to be a full-time student at Georgetown University's Master's of Nursing program, specifically focusing on family nurse practicing. One of my career goals is to really be able to work with the community, with individuals and family members on how they can prevent chronic disease and manage, if for those who actually have a chronic disease, how to manage that. And also bridge the gap between public health and primary care services. That's actually one of the reasons why I chose nursing as my second career field. Before that, I was working in public health, and I noticed that a lot of community members after health fairs would tell me or share with me that they didn't know they had pre-diabetes, they didn't know they were at risk for diabetes, they didn't know that blood pressure and high blood pressure specifically could lead to so many different issues later on in the future. And so it was really neat to be able to, one, educate them in different ways on how they can start making healthier choices. And I really want to be able to do that as a mid-level healthcare provider here in California. And one of the things that makes a nurse is I think we're the boots on the ground people in healthcare, whether it's in the hospital or it's in the outpatient center or in the community. We see a lot, we do a lot, but at the same time, we talk a lot. We have the ability to work with a lot of different people, and I think the fact that we are able to communicate with doctors, to patients and their families, to really being able to watch over a patient, 8 to 12 hours in a single shift, we really are able to see a lot. And I think what makes a nurse is the fact that we're dedicated to our patients, we're dedicated to their health. And being the boots on the ground type of career as nurses, we actually have the capability of being able to impact a lot of people in our lives. What makes me an amazing nurse? Well, I'm a newbie grad, so I think there are a lot of amazing nurses out there. One of the things that I think for myself that makes me an amazing nurse is the fact that I really am dedicated to prevention. I'm really dedicated to the community. More than that, I think what makes me also an amazing nurse is that I really believe in the term pay it forward. For me, I decided a long time ago when I went to public health that I would give up on my career as a nurse, and it was through just different people who made an impact in my life that told me essentially to go and try again. And for me, when I was a nursing student, one of the things that broke my heart was when I heard a high school student at a career fair tell me that there's no way that he could be a nurse because the people where he lives at, his community, they just don't become nurses. And for me, that was heartbreaking, even though I told him he can be a nurse. It may be hard, and there's a lot of hard work, but I think he could be a nurse. And being able to empower someone like that who thinks that they have no chance in being a nurse, whether it's their background or different things that might prevent them from even trying to pursue that, I think it's important for me as a nurse and future nurse practitioner to really empower those who think they can't be nurses to be nurses. And for me, I think that's what makes a nurse. I think it's really cool that we get to empower those around us, whether it's the patient or those who are interested in pursuing nurses. So I can't wait to see what's going to be in part of the 2018 Nurses Week that's coming up. Thank you, FIGS, for the opportunity to apply for this grant, and I really look forward to hearing just all the amazing things that nurses do. Bye!